Hello, I'm Craig Jensen, a pediatric gastroenterologist at Baylor College of Medicine and Texas Children's Hospital. In this clinical pearl, I'm going to talk about probiotics, the basics. So this is an area that has received a lot of attention both in the medical literature and in the lay press. There are several hundred probiotic products that are commercially available. So what is a probiotic? Well, in my bad handwriting, I've written on the board the World Health Organization definition of a probiotic, which is live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. So these are, if you will, microbial good guys. Traditionally in medicine, we've kind of viewed microorganisms as the enemy. They cause infections. We give antibiotics to treat them. But microorganisms also can be beneficial. We all know that in our GI tract there are more bacteria than we have mammalian cells, and these bacteria can influence a host of physiologic functions, GI function, and even functions well beyond the GI tract. Probiotics can act through a number of mechanisms. They can block adhesion of potentially pathogenic bacteria to the bowel surface. They can affect the way the bowel responds immunologically, inflammatory responses. Certain probiotics actually elaborate substances that have direct antimicrobial activity against potential pathogens, etc. When we discuss the potential clinical use of probiotics, we have to keep a number of factors in mind. One of those is that the effect of probiotics cannot be generalized. The effect of specific probiotics is determined not only by the genus or even the species, but is specific down to the strain level. So on the board I've written two specific probiotics. One is Lactobacillus rhamnosus GG, so the genus would be Lactobacillus, the species would be Rhamnosus, and this would be the specific strain. This is another probiotic that's been used in clinical trials done early in life, and I'm going to concentrate on those toward the end of this presentation. So this is Lactobacillus reuteri with this specific strain. So are there clinical settings in which there is enough information from the medical literature to support their use in settings that a general pediatrician or a pediatric nurse practitioner might encounter? In fact, there are a number, and I'll just mention several. One is acute infectious gastroenteritis. So more than 20 years ago, that first probiotic, Lactobacillus GG, was shown in that setting to decrease duration of symptoms. The bulk of the infants in that particular study had rotaviral gastroenteritis, but this has been confirmed or has been observed in a number of other studies, and systematic reviews, meta-analyses have basically concurred that there is a role for probiotics in that particular setting. In addition, antibiotic-associated diarrhea can be ameliorated or at least limited by probiotics. Again, specific probiotics given in specific ways. So that's another application certainly supported by the literature without really any significant adverse effects. Another potential clinical entity that might respond to the use of probiotics is infantile colic. The second probiotic that I've listed on the board has been used in a number of studies of infants with colic. These studies, by and large, have shown some benefit. A study done in Canada this year, 2015, showed benefit in breastfed infants. Other studies have also shown benefit. However, it's important to know that the study results are not entirely consistent. So, for instance, last year, 2014, there was a study done in Australia, the results of which were published in the British Medical Journal, in which that same strain of that same probiotic did not show any benefit. Also, infants who have cow's milk protein allergy, who were given a formula with extensively hydrolyzed casein as the protein source and also containing Lactobacillus GG, acquired tolerance to cow's milk protein more quickly than infants fed a formula lacking that particular probiotic. In sum, probiotics are live microorganisms that confer benefit. Their use is their effects are specific all the way down to the strain level, and all of us await the results of a number of ongoing studies in this area. Thank you for watching this Clinical Pearls video on pediatricnutritionce.org.